Hi, welcome to part 2, Boarding Supervisor Practice. Boarding Fundamentals has 6 parts, and the second part is all about the practice of the boarding supervisor. The assessments for this section are either multiple choice or true-false questions. Boarding supervisors can also be known as housemasters, house parents, youth workers, residential carers, and there is a trend towards using the name residential youth workers. The main role is to supervise, care for and facilitate the holistic development of young people in the boarding residence. And the first multiple choice question, the main role of a boarding supervisor is to enable holistic development, supervise students, teach different sports, care for students. And you'll realise that C, teach different sports, is not the main role. So you would just circle the others or select the others. So common to the role of the boarding supervisor, irrespective of where the boarding house is, what country, these things are common. You're caring for other people's children. There are state and Commonwealth laws that affect your role, or laws of the host country. There are organisation policies and procedures that you must observe. There are duty of care requirements. There are ethical and moral implications for your role. So the second multiple choice, things common to the role of residential supervisors, and you'll see the B there is not really part of your role, so you would just select the others. I think you're probably getting the idea with these assessments. So we want to look at boundaries. So when you're caring for other people's children, you have a professional relationship with these young people. You have this relationship because you are a boarding supervisor. You've put your hand up and said, I'll have that job. And therefore you then have this professional relationship with these young people. It is not a personal relationship, it is a professional relationship. That means there are boundaries or lines that you must not cross, and these boundaries are between appropriate and inappropriate behaviour. They're lines between appropriate and inappropriate behaviour. Also with professional relationships, you'll have a small gap or a small distance between yourself and the young person, so it's quite different to a personal relationship. And so there are a couple of true-false questions here, and in the boarding industry you can have a close personal relationship with students. Is that true or false? Boundaries are lines between appropriate and inappropriate behaviours, true or false? So we want to look at some of these boundaries and we want to identify what are inappropriate behaviours. And so first of all we want to look at communication. So inappropriate behaviour with respect to communication are these things. Inappropriate comments about a young person's appearance, including excessive flattering comments, inappropriate conversation or inquiries of a sexual nature, disrespectful or discriminatory treatment of a young person based on their perceived or actual gender, sexual orientation, use of inappropriate pet names. And so what we're talking about here are not, a nickname that the whole boarding residence calls a young person, but it might be your little pet name for a person, and that's inappropriate. Vilification or humiliation, jokes or innuendo of a sexual nature, obscene gestures and language, facilitating or permitting access to pornographic material, failing to intervene in sexual harassment of a young person, correspondence of a personal nature via any medium. So these are inappropriate behaviours with respect to communication. And you can see here the assessment asks, the following are examples of appropriate supervisor to student communication, and so one of these is an appropriate behaviour. So let's look at these boundaries about personal disclosure. It's inappropriate to discuss personal lifestyle details of yourself and other staff or young people. It is appropriate to share things like, information about your family, how many siblings you've got, those sort of things, or children. It's the personal lifestyle details that we must not be disclosing. With physical contact, these are inappropriate behaviours. Unwarranted or unwanted touching of a young person. So any touching that's unwanted. Sometimes a young person will just come up to us and hug us or lean on us, something like that. Now, we don't push that person away. They've initiated it. If somebody's hugging you, we suggest that you try and avoid full frontal hugs with young people of the opposite sex, and that these hugs are brief, that they're not lingering, but they're just brief hugs. And some people just try and hug on the side. They do side hugs. Corporal punishment, of course, is inappropriate. Initiating, permitting, requesting inappropriate or unnecessary physical contact of any type is inappropriate, and inappropriate use of physical restraint. We're going into physical restraint a little later, but the only time you would use physical restraint is when a young person is in real and immediate danger of hurting themselves or somebody else. And so once I took a wood chisel off a boy or restrained a boy who was about to stab another boy with a wood chisel. And so that is appropriate use of physical restraint. So the multiple choice for this, the following are examples of appropriate supervisor behaviour. And so there's only one of these that is appropriate, and I'm sure you can see which one that is. So looking at boundaries concerning place, and I should say that in some residences these will be a little different. There's a little bit of flexibility around these, so you really need to talk to your residence head of boarding about these. So we would say these are generally inappropriate, and that's inviting, allowing, encouraging young people to attend your own home, allowing young people to access staff members' personal internet locations, attending young people's homes or social gatherings, being alone with a young person outside of your responsibilities, entering change rooms or toilets occupied by young people when supervision is not required or inappropriate, transporting a young person unaccompanied. Now, this is a difficult one, isn't it? Because sometimes you're going to have to do it. Sometimes you're going to have to take a young person to the doctor or to the dentist, and you may have to do it in a vehicle, and you may be by yourself. What we say is this: if you can, get another person to come, another supervisor, or even another student to come with you. If you can't do that, ask the young person to sit in the rear of the vehicle and explain to them that that's a requirement of the organisation. And if you can't do any of that, then sometimes you can use the dash cam. If you can turn the dash cam around, if you have one, so that you are actually videoing the whole ride is being videoed. If you can't do any of that and you still have to transport a young person by yourself, it's good to make sure that people know that you're doing that, and sometimes people will even leave their phone open, so they will ring somebody and it'll go through to their message bank, and they will leave that phone open for the duration of the ride. So it's always a little problematic, the transporting of a young person, just by yourself. Using toilet facilities allocated to young people. Some boarding residences that we go to during the sleepover time, when a person is there supervising students at night and sleeping over, they use the same toilet facilities. We think that this is inappropriate and that you should be trying to get a different toilet facility. You shouldn't be using the same toilet or shower facility as the young people. Undressing or using facilities set aside for young people in their presence. This can be problematic if you're, say, taking a group of young people swimming, and there's one set of, there's one set of change rooms. Generally, what supervisors do is that they will use it first or last, and the young people will use it after them. You can see there's an assessment here, and it's asking for examples of appropriate supervisor behaviour relating to place. And you can see there is one of those that is appropriate. Boundaries, targeting individual young people. These are inappropriate behaviours. This is tutoring outside of the head of boarding's knowledge or direction. Giving or receiving special gifts or special favours. Singling the same young person out for special duties or responsibilities all the time. Offering overnight, weekend, holiday care of a young person unless it's with the head of boarding's knowledge and approval. So boundaries with role. this is inappropriate, adopting an ongoing welfare role that's beyond the scope of the position, photographing, audio recording or filming young people via any medium when not authorised, or using your own personal equipment to do that. And I know that sounds tough. We were just talking to a lady who'd been on a trip with a group of students to Japan, and she'd taken all of the photos on her own camera or her own phone. And these days that is considered inappropriate. However, what you would probably do is that when you got home, you would download those photos onto the residence drive for photos and take them off your own equipment. It's also inappropriate to upload those onto a website such as Facebook, unless, of course, it is the resident's Facebook, and then it's entirely appropriate. So there's a lot of material here in the boundaries, a lot to think about. If you can think about it like this, when you're working with young people, make it public, make it authorised, and make it timely. So make it public. If you have to counsel a person one-to-one, we'll do it in a room where there's a window or a door and other people can see you, or in a public area. If you're doing that sort of thing, counselling a young person, then make sure it's authorised and make it timely. What we mean by that is that you would not do it, in the middle of the night, say from 2 o'clock to 4 o'clock in the middle of the night. And you would, keep it short, and that you would make sure it was timely. So if you just keep those three things in mind when you're working with young people, and this will help with boundaries. And you can see here the multiple choice question. Working one-to-one with young people, there are 3 boundaries, and one of those, of course, is incorrect. We want to talk a little bit about privacy and confidentiality. So we get a lot of information about young people and their situations. We need to treat this information with care. We need to respect the privacy and confidentiality of young people. There's a multiple choice here, and it says, when you have access to information about young people and their situations, you can share it with other staff members and students. We know that is incorrect, don't we? So we wouldn't tick that. You could share the information with care. Yep, treat the information with care. So that is correct. Respect the privacy and confidentiality. That is correct. Share if you have permission. Now, this is not correct, and it's not correct because you only really share information with people who need it. So just having permission by itself is not enough. So only 2 of those are correct. In Australia, we have the Privacy Act, which was revised in 2014. And it details how personal information should be managed. And in your organisation, in your country, wherever you are, you'll have information about how you can share information about young people. So the Privacy Act has the Australian privacy principles. It tells us how we can manage information in an open, transparent way. Tells us what information can be collected, how it can be used, how it can be stored, how it can be passed on, what we do with it later on. All of that is in the Australian Privacy Act, and every organisation will have policies and procedures about privacy and confidentiality. There's some little rules here that are helpful with respect to privacy and confidentiality. Don't share information with people who don't need it. Keep written information in a safe place. So if that's a hard copy, that would be in a locked drawer or a locked filing cabinet. If it's a digital copy, that would be password protected. And of course, don't gossip. And there's an assessment here. Basic guidelines include, and I think you can see which one is incorrect there. So we want to talk now about professional practice. So the whole of the rest of this unit is about professional practice. What does professional practice look like for a boarding supervisor? And when we look at this, we're going to look at it in 4 parts: professional practice, supervision practice, team practice, and administration practice. And we're going to go through those one by one and just unpack what professional practice looks like, what good practice looks like for a boarding supervisor. There's a lot of words in this, and I'm very sorry about that, but we need to go through this. So professional practice with respect to laws or legal issues. This is what it looks like. Consistently acts appropriately in all dealings with young people, understands and follows Commonwealth and state laws and host country laws, knows how to recognise and respond to breaches of laws, is aware of child protection and mandatory reporting laws of their state and territory and responds appropriately, understands the indicators of abuse and what forms a reasonable belief, completes all mandatory reporting requirements, including written reports, follows an ethical process in reporting any breaches of the law or codes of conduct by others. And here's the multiple choice: professional practice regarding the law. And have a look at those. B, knows the exact wording of all relevant legislation. What do you think? Is able to provide legal advice for their boarding residents. I'm sure you'll be able to work that one out. So professional practice regarding the organisation. Professional practice is having a copy and complying with job description, knowing and actively supporting the resident's mission statement and objectives, being familiar with and able to access policies and procedures, and complying with them, of course, having a copy of the resident's code of conduct and complying with it consistently, having a copy of the resident's social media policy, having a copy of and complying with residents' privacy policy and procedures, understanding and maintaining professional relationships, understanding boundaries, modelling positive, responsible behaviour, complying with management instructions and expectations, models punctuality for duties and meetings, models positive standards in dress and appearance, and it's got a copy of and follows the staff grievance procedure as required. And here is the multiple choice question. So what do you think of the last two? Seeks to determine all of the organisation's faults and advises other organisations of the faults. All right, let's have a look at this. This is regarding professional development. And I know that your head of boarding will have a professional development plan for you, but you should have your own personal professional development plan. And in the days of a lot of online professional development, this is not as hard as it used to be. Attends all professional development as required, is up to date with required clearances, licenses, qualifications such as first aid, safe working with children, etc. Seeks help and support when needed from head of boarding or manager or colleagues. Seeks feedback to improve practice. And here's the multiple choice. And you can probably see a couple of those that aren't correct. So this is professional practice regarding workplace health and safety. Has a knowledge of the resident's workplace health and safety policy and is consistent in safe work practices. Has knowledge of the procedures for and practices hazard identification, management and reporting. Responds correctly and consistently to emergencies. Participates in emergency drills and complies with the reporting requirement for emergency drills. Knows how to undertake risk assessment and management as required. Here's a multiple choice. Is able to drive the fire engine for the local fire brigade. Do you think that's right? Uses steel cap boots in all work situations. So we've looked at the first one, professional practice. Now we want to look at this second one, supervision practice. And supervision really is at the heart of our practice, isn't it? It's at the very heart of what a boarding supervisor does or a house parent does. So supervision practice, and this first part is with respect to student safety, understands the concept of duty of care and non-delegable duty of care. Now you may not understand what a non-delegable duty of care is, but this is going to be in the next one of these parts, so you probably will understand it then. It's very important. Ensures that the residence environment and activities provide a high level of safety for students at all times. Knows emergency responses to health issues such as anaphylactic shock and suicidal ideation. Conforms to residents' procedures for safe administration of medication. Here's a multiple choice. So there's one there that's not correct, isn't there? And I'm pretty sure you'll be able to work out which one that is. Next one of these is supervision practice with regard to relationship. And remember, we've talked already about the fact that we have a professional relationship with a young person, and we also know that relationship is, foundational to our practice. So this is good practice, has positive, respectful relationships with students, has nurturing, caring relationships with all students, shows empathy and patience in relationships, has positive, respectful communication with students, reacts and responds to students professionally, implements consistent, appropriate routines in the residence, empowers students to becoming self-managing, very important, empowering young people, manages students or parent complaints appropriately and effectively. And if you have a look at this multiple choice, there's a couple of these that are incorrect, isn't there? The following is effective practice regarding relationship, and I'm sure you can see which two they are. Supervision practice with supervising. Supervises students effectively and actively, being involved and where the students are, so moving around, being where the students are. Actively monitors student behaviour and needs and intervenes effectively when required. Actively contributes to student well-being by supporting students and meeting their needs in a timely manner. Actively encourages and assists students to maintain their required homework routines. Provides interesting, engaging activities as required. Contributes to students gaining life skills. Reads and responds appropriately to the staff daily log, the journal, start handover procedure, whatever procedure you have in the residence. You can see here the following is effective supervision practice, and you can see a couple of those that are incorrect. Supervision practice, so this part is about behaviour management, very important for what we do in the boarding residence. Understands and actively conforms to residents' behaviour management procedures, effectively and consistently manages student behaviour, effectively uses strategies for de-escalation of at-risk behaviour, manages the use of consequences sensitively and effectively uses restorative practice strategies. And if you don't know what that means, that's going to be covered in another part of this. I think it's part 4. Enforces the residence policy in relation to the responsible use of technology, knows when to refer a student for help, and uses residence procedures for referral. So the multiple choice question. So there's a couple of those that are not correct, and I'm sure just by reading through those you're going to be able to see which two they are straight away. So supervision practice regarding cultural support and sensitivity. Seeks to understand and values cultural diversity and practices respect for other cultures. Seeks to provide relevant and meaningful support in different cultural contexts. Effectively manages inappropriate student behaviour towards other cultures. Is willing to develop an understanding of Aboriginal and Torres Strait Islander cultural backgrounds. Seeks to relate well with Aboriginal and Torres Strait Islander students and communities. And if you're listening to this and you're doing the international unit, well, the last two of these are probably not going to be appropriate to you, but I'm sure that there will be important cultural contexts in your residence, and you'll need to develop understanding of those cultures and particularly your host countries. So here you can see the multiple choice questions, and there's one of those, of course, which is not correct. So what you would do is you would just select the other 3. All right, so we've looked at supervision practice, we've looked at what is professional practice, and now we're coming up with team practice and what is good practice. What does good practice look like with respect to team practice? We want to look first of all at leadership. Shows respect and loyalty towards leadership. follows direction from leadership, gives constructive feedback to leadership, and responds appropriately to guidance and correction from management or leadership. Now, you may not always agree with leadership, and there may also be times when you have a grievance or something like that, and there are the procedures in the residence for dealing with that, and you should deal with that in a professional manner. Here's the multiple choice question, and you can see that there's a couple of those that are incorrect, and so you would just choose the other two. The following is effective team practice. So then, effective team practice with the team. Have effective, positive relationships with the boarding team, showing courtesy and respect to all. Uses good communication practices with the team. Collaborates effectively with the team. Attends team meetings and is punctual. Makes positive contributions to team meetings. Facilitates team meetings as required. Follows current work rosters and is flexible to provide relief as required. Sometimes unexpected situations occur, and it's good practice to be able to be flexible to help as required. Facilitates effective and punctual handovers. And here's a multiple choice. And you can see that one of those is incorrect, and so you would just select the others. So team practice and how we support new team members. So good practice supports induction and shadowing as required for new team members, and supports new team members with guidance, encouragement and good role modelling. And the following is effective practice. Ensure that team members respect your superior knowledge and skills. Is that effective team practice? So have a look at those and select the ones you believe are effective team practice. So the last part of this is administration practice. What does good, effective administration practice look like? And firstly, with reporting and recording, completes all records and reports in line with residence policies and procedures, provides documentation on time and as requested. Written communication is neat and well written, as best as we can manage. Completes all medical records and reports as required. Completes all maintenance request procedures and reports as required. Here's the multiple choice. The following is effective administration practice. And there's a couple of those, of course, which are not correct, so you would just select the other two. I'm sure you can see which ones they are. Administration practice. So this is good practice with respect to parents and to the school. Communicates effectively with parents as required. Communicates effectively with the school management and staff members as required. And so here is the multiple choice. And you can see that there's a couple of those that are not correct and not effective administration practice, and so you would just select the other two. So that's the end of this unit. Thank you very much.